Well, good morning, everybody. Welcome to Southeast Family Health Center. My name is Dr. Grant Colfax. My name is Grant Colfax. I'm director of the San Francisco Department of Public Health. And I am absolutely thrilled to be here today with Speaker Nancy Pelosi and so many community leaders to celebrate the passage of the Inflation Reduction Act. I'm especially excited to be marking this occasion here at this brand new state-of-the-art health center, part of the department's network of community health centers, and this center, which is an essential resource for accessible, affordable health care in Bayview, Hunters Point. The passage of the Inflation Reduction Act is tremendously important for people in this community and for all of those who rely on community clinics such as this one, as it gives more people access to resources and health care. Because of this act, seniors and those who get their health insurance through the Affordable Care Act are able to save hundreds, if not thousands of dollars per year on prescription drugs and health insurance premiums. Think about that. Absolutely incredible. It will also keep seniors on Medicare healthy by giving them access to additional free vaccines, which certainly we know can be life-saving. And of course, none of this would be possible without our representatives, led by Speaker Nancy Pelosi, who has been such an incredible champion of advancing truly transformative and historical health care, including with regard to HIV/AIDS, the Affordable Care Act, and now, with gratitude, the Inflation Reduction Act. Ladies and gentlemen, Speaker Nancy Pelosi.
Thank you, Dr. Colfax, for your wonderful opening remarks, for your tremendous leadership in our community, taking us through COVID and now monkeypox, but in so many ways a valued, envied resource that we have in our community. I know that you have a meeting that you have to be at, and so I thank you for honoring us with your presence. And if you have to slip away, we understand. If you weren't so busy, we wouldn't want you to be with us. But it's great to be here with Dr. Colfax, with Jessica Altman, the Executive Director of Covered California. We're so proud of Covered California. That's you, Jessica. With Rafi Nassarian's Advocacy Director of AARP California. Thank you to AARP for making. We can only do so much with inside maneuvering. We can get so far. The outside mobilization, the weighing in of the people on the issue, and AARP has been masterful in that. Thank you so much when we're talking about reducing the cost of prescription drugs. I have to pull this down, you say? You want me to start all over? And said Beatrice, and now we have two VIPs with us. Beatrice Cardenas-Duncan, American Cancer Society Cancer Action Network Ambassador, a leukemia patient, and she is my constituent, which means she is my boss. She is my boss. And Oscar James, a legendary figure here, advisory board member of the Southeast Health Center. Oscar, thank you for making this wonderful occasion possible with Community Family Center. And Keith Seidel. Keith is not speaking, but let's acknowledge, where's Keith? Thank you, Keith, for your leadership here and the hospitality you're extending us this morning, but more importantly, the hospitality you extend to people in the community at this center. It is pretty exciting. The Southeast Health Center, now the Southeast Family Health Center. So here we are. Bay Area families are very grateful for your capable leadership, Dr. Colfax, so thank you for that. And again, I know we all consider it a privilege to be at the newly renovated Southeast Family Health Center. Quality, affordable health care. We took the tour, and when you take the tour, it's about health care and the rest, but it also recognized that health is about your mental state and your sense of community and the value that is placed on you. And people here feel very respected because of the nature of this place. It's just remarkable. We gather here to share the good news that under President Biden and Democrats in the Congress, healthcare costs will be coming down. Powered by our rescue plan to begin with, healthcare is more accessible and affordable than ever. We had tried in the Affordable Care Act to bring down the cost of health care, and we did, except when it came to the cost of prescription drugs. We are about the kitchen table of America's working families. How can we lower cost, increase paychecks, and again, make communities safer? And that is what we have done in these piece of legislation. With the inflation, we had it in the rescue plan, but now we've extended here with the Inflation Reduction Plan, which President Biden signed into law. We add to what we did in the rescue plan by driving down the cost of prescription drugs and extending the premium reductions. This package is about, again, the kitchen table. Here's what the IRA, well, we call it, they don't want us to call it the IRA. Sometimes the Irish get a little touchy about our calling it the IRA. The Inflation Reduction Act means for Medicare beneficiaries in our city. We capped the prescription drug cost at $2,000. This is a remarkable achievement. We have been trying to do this for a while. We capped the copay so that people don't have to, for insulin, $35 a month. That's like 1/10 or 1/20th of where it is. And I have to say, we did that without one Republican vote. Sad to say, without one Republican vote. We banned drug makers from predatory price hikes, which they have been engaged in, and we finally empowered Medicare to negotiate for lower prescription drug prices. That is the big triumph. This is historic. We have been trying to do this for decades, but Big Pharma has weighed in and has stranglehold on our ability to free Congress from that. Now, we want to do more, but this opens the door, and we're very proud of that. It's historic without one Republican vote. And Big Pharma says the Democrats are going to pay for this. Can you imagine that they would say such a thing to threaten us for lowering the cost of prescription drugs for America's families? Again, San Francisco's, with these provisions, can save millions of dollars per year just in our own community. And now we'll hear more from Rafi Nazarians of AARP California on what this cost means for families. But before we do, it's thousands of people in our community are enrolled in Covered California, and this is what IRA does for them. Our rescue plan slashed premiums dramatically. Now we've locked in those lower prices, at least for a period of time. This means we'll keep affordable insurance. The average enrollee in San Francisco could save over $1,400, $21,000 with all of this. We're fortunate again today to be joined by Jessica Altman of Covered California, who can share about how we save more for 90% of enrollees in our state. And we're blessed to be joined by two VIPs, very important people, who will speak eloquently to the IRA's life-changing and life-saving impact. Beatrice Cardenas-Duncan, a leukemia patient, as I mentioned earlier, who knows firsthand the burden of soaring drug costs, and Oscar James, who'll tell us about his cane. Where'd it go? Okay. An advisory board member, Southeast Family Health Center, a Medicare beneficiary, a powerful voice for the Bayview Hunters Point for many years, and his reputation is one he honors us with his presence, as does Beatrice. The law that we passed was possible because of I'll say it again, the outside mobilization. You cannot do your best job just inside maneuvering. There has to be the engagement of the public so that members of Congress know and hear from their own constituents what they need and how they need it. In the terminology that means something to them, because we believe that health care is a right, not a privilege. Too many families face the impossible choice: keep a roof over your head and food on the table, or have access to life-saving care. On the campaign trail over the years, I have seen grown men cry because they just can't pay the prescription drug bills. They have a bedridden family member or something, and they just say, I just can't afford it. And it just keeps getting more. And it was the one element of the Affordable Care Act where we were reducing the cost that just kept going up. And now we have broken that stranglehold. Lowering health care costs is about justice, and these benefits will flow to the most in need: vulnerable seniors, working families, and communities of color. In doing so, we honor Dr. King. Dr. King said, of all forms of inequality, injustice in health care is the most shocking and the most inhuman, he said, because it often results in physical death. Now it is my privilege to introduce Jessica Altman, Covered California, who ensures that our state remains a model to the nation in delivering quality, affordable care to all. Jessica Altman, thank you for being here.
Thank you so much, Madam Speaker, not only for the opportunity to be here today, but for your leadership and commitment in making this day happen. The Inflation Reduction Act will provide critical savings for millions of Americans, including the 1.7 million people in California who get their health insurance through the Affordable Care Act marketplaces, including Covered California, that I'm here to represent. These savings have already empowered Covered California to reach record levels of enrollment, to reduce what our consumers are paying for coverage by an average of 20%, and have been a critical piece in bringing California to its lowest uninsured rate on record, all at the height of the pandemic. By extending these savings for another 3 years, we are bringing health insurance within reach of more people than ever before. This law will help Californians and people all across our country get covered and stay covered. As you know, the Inflation Reduction Act extends the increased and expanded financial help that was initially included in the American Rescue Plan. The law caps health insurance premiums at 8.5% of household income, which means lower monthly costs for more people. The law provides free Silver Plan, which is the average level of coverage for low-income Californians, those who earn less than $19,230 for an individual, or nearly $40,000 for a family of 4 under that amount. And it extends financial help to middle-income consumers, which is those who earn more than $51,000 for an individual and $106,000 for a family of 4, who were previously completely ineligible for financial assistance. Right now, 2/3 of the consumers we serve can get comprehensive coverage for $10 or less per month, and many can get coverage at no monthly cost. We also saw disproportionate gains among communities of color, and low-income families were able to get the peace of mind that comes with quality, affordable coverage, making our healthcare system more equitable at the same time that we make it more affordable. We've seen middle-income families, some of whom were paying 20, even 25 or 30% of their income on healthcare premiums, save thousands of dollars a year. And cementing these savings for an additional 3 years means that Californians and people across the country will continue to have the access to health coverage they need and deserve. Those are a lot of big national numbers, but let me show you what it means for the people here in the greater Bay Area. Right now, there are about 325,000 Covered California enrollees in this region, including 40,000 people here in San Francisco County. In Speaker Pelosi's district, the Inflation Reduction Act will help Covered California enrollees continue to save over $100 per month on average, on top of the financial assistance they were already receiving through the Affordable Care Act. One couple that is benefiting is Aaron and Jacob, who met with Speaker Pelosi last year when the American Rescue Plan was first passed. They are both professional photographers, and their business dried up when the pandemic hit, as was true for all too many Americans. The law helped them keep their coverage at a time when having access to quality care mattered more than ever before. And right now, Aaron and Jacob are paying less than $50 a month for a high-quality health plan for the both of them. Speaker Pelosi, thank you. The work you have done, along with Congress and President Biden, will make a world of difference in the lives of millions of Americans and hundreds of thousands of Californians. It will allow people like Aaron and Jacob to keep the coverage they have and keep the cost of coverage within reach for people throughout the state who do not have health insurance today but could have it tomorrow. Open enrollment begins on November 1st, and I encourage any Californian going without coverage to visit Covered California and see whether coverage is in reach for you and your loved ones, because it is more in reach than ever before. So with that, thank you again to the speaker for her leadership and for this incredible accomplishment. And it is my pleasure and privilege to introduce Rafi Nazarian's Advocacy Director for AARP California. Thank you.
Good morning, everyone. Thank you. Thank you, Madam Speaker and distinguished guests. It's a pleasure to be here with you this morning to talk about the Inflation Reduction Act. After years of discussion and negotiation, and thanks to the leadership of Speaker Pelosi, Congress has finally delivered real prescription drug price relief for millions of older Americans by passing the Inflation Reduction Act of 2022. This historic new law includes many key AARP priorities that will save taxpayers and Medicare billions of dollars, including finally allowing Medicare to negotiate the price of prescription drugs, giving people with Medicare plans the peace of mind knowing that they won't have to pay more than $2,000 a year for their medications, penalizing drug companies for raising the price, their prices higher than inflation, limiting the cost of insulin to $35 a month for those on Medicare, and making many vaccines such as shingles available at no cost in Medicare. These prescription drug provisions in the Inflation Reduction Act of 2022 have broad bipartisan support among voters and are long overdue. Speaker Pelosi, we know you have long been a strong voice of support for lowering drug prices, and we are so grateful to you and your House colleagues for getting this bill across the finish line. One cannot state what a monumental improvement this prescription drug package will be for older Americans and all people struggling to afford their medications. For decades, Medicare has legally been prohibited from using its buying power to negotiate lower drug prices. And up until now, the pharmaceutical industry has been successful at keeping that prohibition in place. This new law will finally change that equation and put money back into people's pockets instead of more profits for pharma. This law will also keep health insurance affordable for millions of Americans who qualify for expanded financial assistance, and will prevent a massive premium increase that would have affected nearly 3 million people. This is so important for AARP, especially for our members who are 50 to 64, who already pay up to 3 times more for their coverage than younger people. This is an enormous victory, but the fight isn't over. Big drug companies will spend millions trying to overturn the new law so they can keep charging Americans the highest prices in the world. AARP will keep fighting big drug companies out of control prices, and we won't back down. Once again, I thank you, Madam Speaker, on behalf of 3.3 California members and all older Californians for your strong leadership in achieving the passage of this historic legislation. And now it is my honor to introduce Beatrice Cardenas Duncan, health and wellness advocate and constituent. Thank you.
Good morning. My name is Beatrice Cardenas Duncan, a health and wellness advocate and a leukemia patient. Going through cancer presents a series of challenges. Among the many trials we face while on our cancer journey, covering the high cost of out-of-pocket for our medication is often one of the most troubling issues, and these costs have contributed to health disparities as patients are forced to delay or forgo life-saving care due. For those cancer patients taking new or specialized drug therapies or medications, which include members of our community, the cost of prescription drugs can be in the tens of thousands per year. As I have conversations with other cancer patients, the topic centers on how our out-of-pocket costs has forced us to decide between paying for our cancer medications or paying for shelter and other essentials necessary to our daily lives. For example, having to purchase additional medication to combat any side effects from the self-induced chemotherapy infusion, which I one of those patients, being able to have a care provider, if affordable, consistent chronic age health problems, but most importantly, being able to address both emotional and social problems that need professional attention. With the passage of the Inflation Reduction Act, which include important provisions to lower healthcare costs, we have taken an important step in creating long-term affordability and will help spread the cost more predictable for patients and survivors. Speaker Pelosi, thank you for your support, your leadership, and your continued efforts to ensure that this very important legislation was successful. Thank you for bringing affordable medical coverage and access to cancer medication to the forefront. You have demonstrated that this is a human rights issue, one that will impact the constituency you represent in the House of Representatives. Earlier, I mentioned the challenges that we face as cancer patients. With this law, there will be reassurances that the cost of cancer medication will be not one of them, that there is a bright future for me. And I look forward to sharing this extended time with my daughter, my son, my 4 grandsons, and 6 great-grandchildren, and to focus on one of the things that truly matter in life, that people give this life a true meaning. Thank you. Muchas gracias. See how excited I get? And now it is indeed with a great, great pleasure to introduce Mr. Oscar James, Southeast Health Center Advisory board member, and a person that we exchanged a lot of history in this neighborhood. Mr. James.
First of all, I would like to give honor to all of the heroes and sheroes of my community who helped bring a lot of this to fruition. I also would like to definitely give all of my respect, my love, and all of the things that she has done to this community, Ms. Nancy Pelosi, Congresswoman, who we all should vote for the next time and make sure Biden becomes the next president again. Like they said before, it was the Democrats who's done this for our community and for our city and our states. So therefore, I'm saying, because of everyone said already what has been done, this health building would not have been here if it wasn't for persons like Nancy Pelosi and people in this community and the city as a whole. Both of these buildings were done. One was done through Model Cities, and this particular building here was done from the work of Miss Ollie Birches, who's our president, and peoples in the community. This building would not have been here. This is a historical building that represents all of the residents of Bayview Hunters Point. If you have the opportunity to go through this building, it'll have history in this building that shows where the African American in this community has done artwork. It shows the heroes and sheroes on the quilts that's in this building. A lot of people's are not on the quilt who were significant in this community. But I just want to be brief on making sure, and I can't say it enough, we need to vote for more Democrats, because this package could have been better than what it is, the naysayers and the ones who do not watch out for the American peoples did not vote for this package. So therefore, Miss Nancy Pelosi, you know, she's brought a lot of money into this community. She brought money to help with the Hunters Point shipyard, with our brothers and sisters in this community, all brothers and sisters in this community. They had asthma, they has mental problems, and things like that. She's done a lot to bring that money here to this community. So we owe her a debt. The city owes her a debt to try and making this community and making this city safe for all peoples. So with that, I'm going to quit because I can go on and on. But I just love you, and just keep doing what you're doing, and vote the next election, her back in office, and Biden back in office, and Trump and his peoples, when they were saying what we shouldn't do and we should do. We're watching out for the peoples of this United States and this community. Thank you very much.
Thank you very much, Oscar, for your great leadership in the community, your appreciation with so many of us working together, we're able to accomplish. And you mentioned asthma. Earlier, I saw a precious little child across the street. We waved and kissed and that. And it's really important to note that in this legislation, the Inflation Reduction Act, we have the biggest commitment to protecting our environment, to saving our planet with environmental justice ever instituted by any government, any place, at any time. And this is, again, environmental justice is very important, a part of what President Biden is about health justice, about environmental justice, about infrastructure justice, about equity, and he puts resources there to make it happen. Because, again, the subject of asthma and its occurrence in communities of color especially is one that is an immorality in our society. And this legislation goes a long way for clean air, clean water, as we, again, protect the planet for the children. So thank you for mentioning that, Oscar, and for your very kind words. This is, again, this bill was about health care, and we consider the health of our planet a health issue as well. So I didn't want to just focus on the health aspects of it without segueing into what else is in the legislation. In 2005 and 2006, when we were running to take back the House for the Democrats, we had 6 for 06, a new direction for America, 6 for 06, 6 pieces of legislation we would pass in the first 100 hours of the new Congress. We passed all 6 of them in the House. 5 of them became law. 1 did not. And that one that did not prevail in the Senate was to enable the Secretary of HHS to negotiate for lower prescription drug prices. We had been fighting for it for a while. We put it on our agenda. We passed it in the House. We couldn't get it through the Senate because of the stranglehold that Big Pharma had. And we've been trying before then and ever since. With the outside mobilization, AARP's help, and all of you, and the courage of my members in the Congress to just take that vote, and the leadership of President Biden, we have made history. And we have made progress for our seniors, for our people. I'm sure we'll all be honored to take any questions that you may have. Any questions? No? We anticipated all of your questions that you may have. Yes, sir. Yes. Yes. Well, it's very disappointing because actually the reason I have all the security I have is because I'm second in line to the presidency. That never will happen, but nonetheless, it is a continuation of government issue. So you would think that the Secret Service would have everybody else in the line, all the secretaries of cabinet who follow the Speaker of the House in succession have Secret Service protection. The President, the Vice President, of course, have the most secrets. But they had just decided that they wouldn't do that. It's totally irresponsible. But we have some questions about the irresponsibility of the Secret Service at the time of January 6th. Some of them performed magnificently. Some of them did not. I have many threats, I probably more than anybody except a presidential candidate, and but I'm more concerned about the safety of my members, the safety of our staff, the safety of those who cover us in the Capitol, and you see the frivolousness with which the Secret Service treated that. I had the protection of the Capitol Police, to whom I'm very indebted. They saved our democracy on January 6th, the Capitol Police did. So. Yes, sir.
Does the strong Democratic showing in the primaries portend well to the party looking forward?
Yes. Yes, no, this was a big victory for us last night. Since Oscar talked politics, I will too. But that's the question. I would not have brought up a political subject. But we had a big victory last night. People were stunned by the fact that in a district that was not supposed to go Democratic, that it did. I give credit to our candidate, Pat Ryan, excellent, a veteran, a public servant, a small business person, bringing so much to his candidacy, and will bring so much to the Congress very soon, because he has won the special election. So I get one more vote. Now, when we have accomplished all these things under President Biden's leadership, the rescue package without one Republican vote, the infrastructure bill, the bipartisan infrastructure, with some Republican votes, the issue of chips and science and the rest with some Republican votes, and now the Inflation Reduction Act with no Republican votes. We have 220 Democrats in the House. Franklin Roosevelt had 319 Democrats in the House. So we have to do this very carefully, and I'm very proud, as I said, of the courage of our members. But this was Republicans should be very, very, very scared this morning about their prospects. I have never believed that we would not hold the House. That's my mission, and that's what I hope to accomplish, and I have a plan to do it under the leadership of Sean Patrick Maloney. He had a big victory himself last night. He's our chair. But this one, they expected to win, and they outspent us, but we out-organized them. And that's what we are. We don't agonize, we organize. I'm sorry, what do I think of the what? Oh, yeah, well, we have it in this bill that we will reduce the cost of insulin. But we had the insulin bill on the floor on its own without anything else. And we only got 20 Republican votes. That means 190 Republicans voted against it. Now, this bill had more because it had climate and it had reduction of this or that. So you could, since they think that the climate crisis is a hoax, you see, well, they had that excuse not to vote for this. But when it was insulin alone, it was we're only able to get 20. We thought, how could they resist this? Insulin is costing maybe $600 or $300 a month. This takes it down to a $35 a month copay. You would think that out of respect for their constituents and the broad need, as you mentioned about your daughter, that they would represent their constituents. But no, they represent big pharma, and that's really what the success was in this bill, that we were able to loosen the stranglehold of big pharma on our families. So thank you for your question, and thank you. Well, thank you all so much, and let us thank again these Family Health Center. Thank you, Doctor, for your leadership. And it's wonderful being in the community. Oscar has given me these hidden figures. These about the math women. It's a hidden Black excellence patents, inventors in every way, taking great pride in the African American community as we do. You have to know about this area. This area was the leading area in San Francisco of home ownership. This is about community. And the word community, as we are reminded when we come here, has the word unity in it. And that's what this health center is about. When you go through there, you see the welcoming presentation called Woven Calm. Woven Calm. Just that respect that it has for the people coming in, to calm them, to meet their needs, again, to provide a community center when they can come together, share their thoughts, organize, not agonize, and make the future better. So, for the children. Thank you all so much. Thank you.